Facial trauma can be categorized into two broad categories, soft tissue and bone injuries. So soft tissue trauma would be somebody that gets a laceration, whether that's from an accident, a dog bite, where there's an injury to the skin that would typically require some form of suture repair. Then you also have bony injuries, so facial fractures, which would involve typically a higher intensity of trauma, whether that's from an assault, a car accident, some form of trauma where you're going to break one of the bones in your face, be that your nose, your cheekbone, your jawbone, really any of the bones in your face can be broken. Most facial trauma patients are going to present to the emergency room following the injury. Occasionally, if it's a minor injury, they might go to their primary care doctor or their pediatrician, or occasionally they'll come directly here to our office. But the majority of the time, those patients are going to be in the emergency room for care of the injury that occurred. We provide coverage for both emergency rooms in Duluth. Those would be the emergency room at St. Mary's Medical Center and at St. Luke's Hospital. There's a variety of facial trauma, from a small little laceration on a child. It's not technically that hard to take care of, but that can be very gratifying, to the big major facial trauma from a four-wheeler accident or a car accident where you're going to spend pretty much the entire day piecing their face back together. Obviously, from a training technological standpoint, it's very gratifying to use all your skills to do that. Most facial injuries are going to be a result of some, especially facial fractures are going to tend to be injuries that you see more often in the summer: motorcycle accidents, obviously car accidents, four-wheeler accidents. Winter, you'll see some snowmobile accidents, but up here, you also get the unusual accidents. Some sports-related injuries. I just had a person that had a baseball ricochet off their bat and broke their cheekbone. So you never really quite know exactly what's going to come in on the weekends. Plastic surgeons are trained in a broad variety of things. Facial trauma is kind of in our wheelhouse for taking care of, just like you would cosmetic patients that require surgery to the face. And part of the face is it's aesthetic. So if you have a injury to your face, you want it to look back as normal as you can, and that's something that plastic surgeons have extensive training doing. The key I look for is have a plastic surgeon that's board certified, that verifies that they've gone through all the extensive training to be able to take care of really any facial trauma that were to happen.